Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapists. In this episode of the Need to Know Show, we're going to answer the question, how young is too young to have a knee replacement surgery? Well, to start things off, I'm just going to say that it really varies. There is no set age of when you are able to have a knee replacement surgery or when you are too young and not able to have a knee replacement surgery. For some individuals, they might require a knee replacement surgery at a very young age. Some things you might think about is people who have been in a traumatic accident, either through athletics or a car accident or whatever that may be, where the knee joint has deteriorated at a significant rate. You also might think of people who have autoimmune diseases that may cause increased and rapid breakdown of the knee joint, or people who might have some congenital deformities where their knee is not aligned well, or for whatever reason it just might break down a lot faster than just a normal individual's knee. So in those instances, some people may be very young when they have their first knee replacement surgery. Now, for a lot of individuals and the majority of folks, the reason for having a knee replacement is progression of arthritis within the knee, causing breakdown of the cartilage and, of course, the symptoms of stiffness, pain, discomfort, inability to tolerate things. Now, for most individuals, we want you to wait until you're into your 60s, into your 70s. The average age for a knee replacement is about 65 years old. And the reason that surgeons and physical therapists and individuals want you to wait as long as you possibly can is because a knee replacement has a lifespan. So you may look at all different videos online and hear different things. Some may say that a knee replacement on average lasts 10 years. Some may say 15, 20 years, I hear a lot. And some may say that you might expect your knee replacement on average to last even a little bit longer than 20 years. But the idea is there's a lifespan of your knee. And so the earlier that you have a knee replacement surgery, the increased likelihood is that you're going to need a revision surgery, either because of breakdown of the knee replacement, the plastic components start to break down and particles start to come off of it, loosening of the knee replacement, or some other type of complication. And so a revision knee replacement surgery is similar to a normal replacement, but it's a little more intensive, a little more involved, and you actually have to remove the prosthetic components of the first replacement, and you actually have to kind of remove some of the bone, and you're affecting some of the bone that you're going to then be using to put on the revision components. And so you really have to have adequate bone stock, what it's called, or enough bone that it's able to adhere with the components of the revision and be successful and not loosen. And so it's a little more complicated, a little more involved type of surgery that has, although not super significant, but a slight increased risk of having some difficulties. And of course, you also have an intensive rehab process to go through, just like with your first knee replacement surgery. And of course, with any surgery, there are risks. And if you're older and getting a revision surgery when you're, say, in your 70s or 80s, now there is a chance that you might have some increased risk of complications. Although not super significant, there is still that increase. So all that put together is we want to limit that risk of needing a revision surgery as much as we possibly can. So this means waiting as much as possible. This means using conservative treatment strategies, exercise, physical activity, weight management, activity modification, possibly some pharmacological, possibly cortisone injections, possibly the viscosupplementation. Trying different strategies to wait at least until, ideally into your 50s, into your 60s is even better. The longer you can wait, the less you have that risk of needing a revision knee replacement surgery. Now, that being said, at the end of the day, you got to do what you got to do. If your symptoms are so debilitating, if you've tried conservative treatment and it has been ineffective, and you just need some form of relief, Of course, we don't want you going around in debilitating pain and discomfort and stiffness and symptoms. That's just not right. So in some instances, you just have to do what you have to do, and you may have a knee replacement surgery at a quote-unquote younger age, maybe in your 40s, maybe in your early 50s, maybe even earlier than that. But the ideal thing is to wait as long as you possibly can with conservative management to try to reduce that risk of a revision knee replacement surgery. I hope you found this video helpful and useful. Be sure to leave your questions below and I'll be sure to get back to you. Be sure to turn on subscriptions and the notifications so you can catch all our videos related to knee replacement surgery, preparation, recovery, frequently asked questions, exercises, everything else in between. Thank you very much for watching.